Welcome back to another edition of First Response, a project of the Addis Board of Lorain County. As you all know, September is Recovery Month, and today's topic is Access to Recovery. Our guest speakers are Don Crow, Site Director of Firelands Behavioral Health, and Jeffrey Cams, Executive Director of Road to Hope. Welcome, both of you. How are you today?
Fine, thank you.
Good, thank you, Brian.
It's very nice to have you, and I appreciate you guys coming out to help us get this information out and inform the public about Recovery Month. Today's topic, as I was mentioning, is access to recovery. Don, a couple questions for you in regards to access to recovery. Is drug abuse treatment a one-size-fits-all?
It's actually quite the opposite. Treatment for substance abuse, behavioral health needs to be extremely individualized. It really is based upon what an individual comes into treatment needing, what kinds of resources they have available to them, their drug that they might have been using, how long they have been using it. All of those types of items factor into what their particular treatment plan should look like.
Great. Now, where would someone call to find treatment?
There's a variety of different places that folks can look at. They can double check if they have an insurance provider on that insurance company's website or call the customer service line. You can also take a look at the 211 info system. You can double check under substance abuse, addiction, counseling, etc. And then the best local source is our local Addis Board, which stands for the Alcohol Drug Addiction Services Board.
Okay, now do people need insurance to get treatment?
They absolutely do not. Many insurances will cover substance abuse treatment, but we also do have in Ohio expanded Medicaid, and that has really been fundamental for folks to be able to get the health care, including substance abuse treatment that folks have needed. And then for those individuals that don't have any type of insurance, again, that Addis Board, Alcohol Drug Addiction Services Board of Lorain County, does take funds that are provided by the state and federal government and will contract those for services for folks that don't have any type of insurance.
Okay, now say, for example, I'm listening to this and I decide I want treatment. From the time that I decide that I want treatment, from when I reach out, how long will it take me to actually get into treatment?
That's always a very difficult question because of what you asked originally. Because the treatment process should be very individualized, it really kind of depends, the answer kind of depends on what that person is actually trying to access. There could be very high-level services that require an inpatient stay. There could be groups, there could be individual counseling. We obviously would say that the sooner somebody can access treatment after asking for it, the better that is. I would hope anyone could access at least an assessment within a week of calling.
Now, to grow on that subject, what are the components of a comprehensive drug abuse treatment?
So again, it could start off with almost a medical type of intervention, especially for folks that are using substances that could be either health or life-threatening. When they stop those services. Those could be in a inpatient hospital setting. They could be on a residential setting, and that's usually called detox, very short term. Then you go on to a variety of different outpatient settings, maybe some residential in there where you live again for a while. But on an outpatient basis, what you're really doing is getting a variety of education around addiction as a disease process. You're also then learning and processing new skills and awareness types of skill sets there. And you may also be getting what's called medication-assisted treatment, and that is a set of medications that are used for substance abuse the same way that we use medications for other health concerns or mental health issues as well. After you move through that skill building, then you're going to look at supportive services, aftercare services, and those are really to help you use those skills as you master new difficulties that crop up in life.
Wow, that seems to be pretty extraordinary. And hearing that brings me to my next question, and I'm going to share this one with Jeff. What prevents folks from actually seeking treatment, especially knowing, going through that embarrassment and those first stages of, wow, I really am an addict?
Well, I think one of the biggest barriers that they first face is fear. The fear of what's next, what's coming next. How do they get help is another big barrier. And if they're willing to get help, how immediately they can get the help that they need. Then they question, like, how are they going to get the help? Is this going to require insurance? Is it going to require money? How financially are they going to be able to seek the help that they want? So not understanding that their immediate step is just to reach out and ask for the help, and let the people that they contact figure out the rest of the obstacles that are in front of them. So
Great. And so often, we hear of people that go into treatment and, okay, what do they do next? So my question to you is, what supports are available for someone to truly be successful after treatment?
okay. Well, one of the things when they're finishing up or coming up to the end of their treatment, and like Dawn was saying, there's a variety of different levels of treatment, so that would kind of be on an individual basis. But after the initial stages of treatment, what is it that's following up with that? And obviously one of the services that are out there is peer supporting. There's some agencies that provide peer supporting where they can get hooked up with an individual that has, lived experience in this, disease and in addiction, that they can provide them with the next step and where to go from there, and start introducing them to different groups and different support groups. One of the other resources after treatment is recovery housing. So a lot of times they don't want to go back to the atmosphere that they came from, because that lifestyle and that atmosphere sometimes creates more obstacles that can interrupt their recovery. So they want to look at, into a resource like recovery housing, where they're in a safe environment and they can have the support and the direction that they need moving forward in their recovery. And then they have recovery groups and recovery meetings, and there's a lot of community support groups that have started. And by contacting the county Addis board, they can find out where a lot of those community groups are at and where the meetings are located and held at. So
Fantastic. And that Lorain County Alcohol Drug Addiction Services phone number again that's 440-282-9920. Before I let you go, Jeff, there's two more important questions that I have for you, because I know there's many different resources and many different tools that different providers kind of share with their different addicts. My question to you is, what part does the 12-step or similar recovery programs play in the drug addiction treatment process?
Well, treatment in the beginning mainly focuses on the education, teaching the individual what's going on with them, why they're having the issues that they have, and some direction on how to overcome those issues. Where 12-step or support groups or recovery groups, they focus on building a support network of individuals that are there to support them moving forward. They are there as a support network. They are there to help provide them an atmosphere or a lifestyle that's going to be different than they're accustomed to. I know a lot of times individuals that are having problems with substance abuse don't understand that there's a life outside of that. And, that's where these recovery groups really come in, is to show them that there's a world that's going on outside of them and outside of that addiction that, does not involve, alcohol or drugs and the problems that they're trying to overcome. And that's where those groups really play a big, huge role, is to show them how to live life outside of the addiction problem that they have.
Now, being someone that came from a very toxic environment myself, and a resource that was not there for me, when I was first going through recovery, I looked and I said, well, what am I going to do once I get out of treatment? I have to go back to the same home or the same place that I came from. Tell me a little bit about the hope that is now there with recovery housing.
Well, just like you, myself, when I first, got out of my addiction and being a member in recovery, one of the things was, what do I do from here? And, when I got out of where I was getting help at, it was like, where do I go from here? And I didn't have anywhere to go. And that was one of the reasons that really I got involved with recovery housing. And in the beginning, a lot of times it's called sober living or halfway houses, or, but recovery housing is more of a focus on, long-term recovery and accountability and people playing a part in an active role in the individual's recovery. But, when I got out, I didn't know where to go, or at night, when I was accustomed to feeling a certain way, or the struggles were happening in my mind, and I didn't know who to access to get support for that. A lot of times, the battle that's going on inside of us at 10:30 or 11 o'clock at night, there isn't a counselor that I can call, or a treatment agency that I have 24/7 access to. So it was like, where do I go from here? And so through that and through some individuals, it was one of the things that kind of drived me to get involved in recovery housing. And so what recovery housing is it's a safe, stable, quality living environment, and it puts people around each other that when I come home from work at the end of the day and I start dealing with struggles in life, there's other individuals there that are going to help support me through that and help guide me in the direction that I need to keep moving forward in my recovery, versus letting life obstacles and things that come up throughout the day interrupt my recovery and have me back in that vicious cycle of starting all over again.
All right, great, thank you. And before I close, one last very important question that I have for you, Dawn. For those out there that have tried recovery, that have failed, that are still trapped in this cycle, most important question of all to me, does relapse mean treatment failure?
That's something that we think is very, very important point to get across to folks. I think it's very common for the general public to feel that the treatment for substance abuse has a pretty low success rate, or that if there is a relapse, it means that automatically constitutes a failure. And what we really know these days is that substance abuse is a chronic illness, but there are lots of other chronic illnesses out there as well. Just to name a few: diabetes, or heart disease, high blood pressure. And we seem to understand that those are lifelong disorders that need a certain amount of care and maintenance. And when somebody, for example, may be diabetic and taking insulin, they may need to go in and have that insulin adjusted. Well, you could call that a relapse. And that's kind of what we're talking about here with substance abuse as well. We need to see a relapse as an opportunity to learn more about ourselves and what our needs are, and then to be able to tweak needs to be changed in our personal lives or in our treatment lives in order to take care of what contributed to that relapse. So it is not a time that you want to despair and give up all hope, but you want to say that it is just part of a chronic illness, and we constantly need to be paying attention to what we need to do to stay healthy and well.
All right, thank you. And thank you both for coming today and sharing this vital information with the general public, and especially with those that are still suffering. Thank you so much, and have a great day.
Thank you.
Thank you for having us.